This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised, and we encourage self-care and seeking professional support as needed.
There'd been so much sacrifice, including lives lost of some of the frontline responders. I recall a WHO colleague that also died in the frontline. But at that moment, none of these achievements, none of these sacrifices counted or mattered to the world anymore. And the media brutally exposed the allegations.
On this episode, I speak to Fiona Braka, WHO's Program Area Manager for Emergency Response in the African region. She reflects back on the Independent Commission's report on the allegation of sexual misconduct during the 10th Ebola outbreak in the Democratic Republic of the Congo.
I felt sorrow for the victims and just imagining what they had gone through, and I also felt a sense of shame that our organization was being reported at the center of the allegations.
She shares examples of how the region ramped up the WHO emergency responses with systematic inclusion of the prevention and response to sexual misconduct.
So every incident management team that we set up for the graded emergencies, there is the PRS component there as part of our own accountability.
This is the #NoExcuse podcast. We discuss the challenges, complexities, and potential solution in preventing and responding to sexual exploitation, abuse, and harassment in the humanitarian and development sectors. You'll hear interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and Global PRS Network Coordinator for the department. Welcome, Fiona Braka, to the #NoExcuse podcast.
Hi, thank you for having me.
You work in the region that has the most public health emergencies. You are WHO's Program Area Manager for Emergency Response in the African region. The region holds 60% of the world's public health emergencies. It also navigates political unrest, armed conflicts, and natural catastrophes. What motivates you to work in emergency?
The African region has the largest burden of public health emergencies compared to any other continent in the world. We are witnessing increasing frequency of these emergencies in terms of multiple emergencies, the severity of the emergencies. And it's majorly due to a number of things happening, the interface between human, animal, and the environment. We are seeing the impact of climate change. We're seeing conflict and forced displacements. And these emergencies really are resulting in severe consequences. There are high fatalities, and it puts a strain on the already vulnerable populations, but also the health systems. And we have seen that ultimately socio-economic disruption also occurs in such situations. In our setting, we need to be fast. We need to be effective in how we mitigate and contain emergencies. It's so critical here in the region. So indeed, our context is challenging. And depending on the nature of the emergency, it can even spill over to beyond national boundaries, to multiple countries, if we don't contain them in real time. My motivation is driven by the very nature of this work. Public health emergencies is an exciting and it's a dynamic field. More importantly, it's one that gives an opportunity to make a difference and to save lives. The work we do is serving vulnerable people in need. So whatever we do, we can make a huge difference in terms of reducing suffering, saving lives, and more broadly impacting socio-economic status of countries. All these are tangible outcomes of what we do. We also have the opportunity to be a voice to the voiceless, to tell the story that the world many times doesn't get to see or to hear, And so for me, the opportunity to be part of the system that brings help and hope to others in need is one that I take as a privilege, and it brings me satisfaction. This is not just work, but a service to humanity.
In 2021, you were in the regional office the day the Independent Commission's report was released on the allegation of sexual misconduct during the 10th Ebola outbreak. How was it? How did you feel?
The 10th Ebola outbreak was a long, complex, and difficult outbreak to contain. Among the complexities of that outbreak was the fact that it took place in an active conflict zone. It took close to 2 years to contain, and it was the second largest Ebola outbreak in history. We recorded close to 3,500 cases, and over 2,000 lives were lost during that outbreak. WHO deployed over 1,500 people, and these people teamed up with a large workforce in the field. The count at the end was almost 16,000 frontline responders to respond to this outbreak. So it was a huge effort. And finally, the outbreak was contained and it was closed in June 2020. So fast forward to 2021, and I recall listening to the presentation of the Independent Commission's report on the allegations of sexual misconduct in the DRC. It was shocking and horrifying, and I felt sad. I felt sorrow for the victims, and just imagining what they had gone through. And I also felt a sense of shame that our organization was being reported at the center of the allegations coming from the very communities that we were meant to save. This was one of the darkest times we faced as an organization. And, hearing and reading the stories of the harm and the exploitation of the people we were meant to serve and protect was just unbelievable. I recall a part of me also felt hurt knowing that so much work, so much effort had been put in by WHO into responding to this very difficult outbreak. There'd been so much sacrifice, including lives lost of some of the frontline responders. I recall a WHO colleague that also died in the front line. But at that moment, none of these achievements, none of these sacrifices counted or mattered to the world anymore. And the media brutally exposed the allegations and the organization. It was a very dark moment for us as an organization.
In your opinion, what needed to change?
There was work to be done internally and externally as an organization. The report exposed major gaps in safe programming of our operations. It was obvious that this was an area we needed to pay more attention to ensure we avoid as much as possible this ever happening again. From the emergency perspective, we suddenly woke up to the realization of the greater risks and the vulnerability of our work due to potential abuses of the personnel that we deploy or the collaborators. As you know, emergency response necessitates quick mobilization of capacities for timely response. And by nature of being fast, coupled with all the increased vulnerability of the people that we serve, this further enhances the risks and it creates more vulnerabilities to potential abuse if mitigation measures and safe programming are not integrated or embedded in the response. So at that time, it was critical that we regain the trust of the communities and of our donors who entrust and support us. We needed to quickly institute change and yet be also agile and ready to respond because these emergencies don't rest. So we needed to move quickly. We needed to learn from our partners, notably the Interagency Standing Committee on how to embed measures for protection of sexual exploitation and abuse in our operations, and to start implementing as we learn. So we had work to do concurrently. To facilitate this embedding of prevention and response to sexual exploitation work, it was important for us to review our WHO emergency response framework, which essentially guides our work. We needed to incorporate these measures for prevention of sexual exploitation in our operations and ensure that we are also aligned with what is being done by the Interagency Committee. This alone was not adequate. We also needed to have the technical capacities for this area of work in our ongoing operations and to ensure we have the resources to implement what is required. I think the other thing that needed to be done was the victim side. The victims in DRC and handling their grievances urgently was of paramount importance because DRC is extremely vulnerable to emergencies, and we are constantly in one emergency after another. So ensuring we regain that trust with the communities was central to our overall goal of trying to respond and save lives. I think the other aspect was the corporate side of it as an organization. There was need to try and rebuild our image as a trusted and reputable organization. The world wanted immediate action on addressing the concerns in the report, and this resulted in an organization-wide effort to address these gaps. And ultimately, from an emergency point of view, we were working within that overall corporate direction. There was a need for looking at our internal organizational culture, how we break internal barriers of silence or fears, how we institute mechanisms for dialogue and encourage the culture of reporting misconduct by our own personnel. So a lot was needed, a lot was expected, and a lot was needed quickly as well.
And so, fast forward 2024, and based on your experience, what are some of the key lessons learned as you integrate the preventive and responding measures to sexual misconduct in these emergency responses?
We have come a long way since 2021 through the intensive efforts that still continues still today. I must say that we are now more enlightened about the importance of integrating prevention and response to sexual exploitation in our emergency operations. And thanks to the WHO policy and accountability framework, which is instrumental to guide the work we do in emergencies, the Corporate 3 work plan, which provides a roadmap for strengthening the institutional capacities and promoting organization-wide accountability, we are making good progress. We now have a revised emergency response framework that has incorporated measures to prevent and respond to sexual misconduct, and it is operational. We have already started to roll it out in the countries. Our emergency standard operating procedures have also been updated. Prevention of and response to sexual exploitation is an important subcomponent within the incident management system. And we strive to implement, there's a minimum 10 core functions for community-facing programs. So every incident management team that we set up for the graded emergencies, there is the PRS component there and some minimum actions that have to be followed and monitored and reported back as part of our own accountability. We are working closer with other UN agencies in the field to ensure communities are sensitized and they know where or how to report concerns. And WHO is contributing to the collective efforts as a UN to ensure victims are supported. However, we face challenges. There are some challenges in fully implementing these measures. One is that, given the scale of the emergencies in the region, many times occurring concurrently, we need adequate technical human resources for PRS work that is mobilized on time. Remember, time and efficiency are core to what we do. So the demand is high for the region. And there's an overall global shortage of qualified, competent technical specialists to meet this ever-growing need and the increasing graded emergencies in the region. In addition to that, some of the emergency response operations are not adequately funded, so including the important PRS work, so creating more risks and vulnerabilities for the communities, for the responders, and for the organization. We also recognize it's important that we are part of the collective actions on PRS work in field operations that are aligned within the UN and other interagency standing committee partners. However, these structures, the ISC structures to coordinate the collective actions for PRS only exist in a handful of countries. So that results in some gaps in field operations and in particular for public health emergency operations. So all in all, I think good progress. It is building up. And we need to continue it's an everyday effort. Whenever these emergencies occur, we have to keep constantly conscious of these risks and vulnerabilities and ensure that we are implementing the minimum standards as expected and described in our response framework.
And to end on a personal note, in the world of emergency, as you said, you need to be quick, you need to be efficient. What advice would you give to other professionals working in emergency response about preventing and responding to sexual misconduct?
My advice to other professionals, to colleagues, we love the work we do. We are motivated. We want to save lives and we go out with the full force that we can, with the resources that we have. But we always need to remember that the work we do by nature exposes us to risks, not only to ourselves, but also to others. The people that we serve are already vulnerable due to the conditions that they are under. It may be a humanitarian crisis, a disease outbreak. That's the nature of the work we do. It's already vulnerable. Our actions towards these populations we serve matters. It's not just the response to contain the emergency and to save lives, but how we conduct ourselves matters. Our behavior and our conduct are extremely important. It takes just one wrong act to tarnish the hard effort of the response, not just your effort, but the organization's effort. The nature of our work is that we are in the spotlight. We need to remember we don't only represent ourselves, but we carry the organization with us. And we need to act professionally at all times. We need to speak up when there's a problem. We need to look out for our fellow colleagues and help those that may be facing these kinds of situations, either there's sexual harassment or there's abuse. We need to look out for each other and help one another. And we also need to play our part to ensure that we understand the do's and the don'ts and ensure that we comply so that we are on the right side of our conduct as we move along to respond and to contain these emergencies. And overall, we need to take care of ourselves. Our physical and mental well-being is extremely important. We cannot serve these vulnerable people if we ourselves are not in the right frame of mind or physical state. So we need to take care of ourselves and we need to take care as well of the people that we serve.
What is one thing that you do to support your own, self-care or your own well-being? Because this is something that aid workers struggle with. They are in service and sometimes forget about themselves. What do you do, maybe on a daily basis, on a weekly basis, to support your own well-being?
It's been a journey, and with the intensity of work that we have and the unpredictability, I think one has to find a balance. First, in recognizing that your frame of mind is extremely important and your physical well-being at any time, and to be ready for those unpredictable situations, extensive, intense situations that this work demands of us. I find the balance in daily habits and also in things that I do maybe weekly, trying to ensure that mentally I rest when I can. So that sleep is extremely important. But I also, I try to put in, whether it's 20 minutes or 40 minutes of exercise, just a brisk walk. Of course, it's sometimes very erratic because of, sometimes where you will find yourself, you cannot take those walks. But I try to do that 20 minutes at the very least or 40 minutes in the mornings. And then I'm also very much spiritually grounded. So that keeps me in balance, in keeping faith up, in keeping hope up, in keeping my spirits up. That is what I ultimately rely on at the end of the day for some of that strength and hope. And of course, family. Family is so important. They are an outlet. They are a great source of support. It's important to be able to share and to speak and not be isolated. So the social connection is also extremely important to keep us balanced.
Thank you so much, Fiona, for sharing.
My pleasure. Thank you so much.
Thank you for listening to this episode of the World Health Organization's #NoExcuse podcast. We hope we've given you another perspective on preventing and responding to sexual misconduct in the humanitarian and development sectors. We release new episodes every 2 weeks. But if you have any feedback, questions, or suggestions in the meantime, feel free to reach out at prseah@who.int. Until the next time, goodbye.